Bar bodies are used for karyotyping in case of the female. Verroque body, where do you see? Recently also we have seen AIIMS, PGI, JIPMER, trinity of exams. So you have schwannoma, Antony A, Antony B, you must be very sure. So Verroque or Antony A bodies which are typically found is what need to be remembered. Now doctor, in acute inflammation, inflammatory mediators, ECOM, PCOM, etc. 5th and 6th high yield topic in the topic list given to you in pathology. So you must definitely revise it. What is ECOM doing function? It enables adhesion of leukocytes. Then what is PCOM? PCOM is platelet endothelial cell adhesion molecule. What is the CD number of it? CD31. What chromosome you need to remember? Chromosome 17. And what is the function of PCOM? PCOM removes the aged neutrophils from the body is the function, not neutrophilic activation. Selectins, what is the CD number you need to remember? CD62 or the selectins is what I want to underscore. Once more, E selectins on endothelium, L on lymphocytes, P on platelets, and also endothelial cells is what I want to underscore. Leukemia, lymphoma, एक chromosomal rearrangement नहीं है तो there will be no PG entrance. T821 is there. That's the reason. What is your answer? Come on, you are all now ready to fight and face the exam. Absolutely right. AML. 821 AML, 1517 APML, 822 are Burkitt's, 1221, 922 are basically ALL, and 922 long is CML. 1418 follicular lymphoma, 1114, 1118 are mantle and marginal zone lymphoma. Even 114 is marginal zone, and 25 is anaplastic large cell lymphoma. If you don't like also, start liking it. Over a period of time, you will start adoring it, right? So, प्रिपरेशन ऐसा ही होता है. कुछ सब्जेक्ट्स पढ़ने के लिए मन नहीं लगता, कुछ फटाफट 1 घंटे पढ़ने के लिए लगे तो 15 मिनट में भूल जाते, ऐसे टॉपिक्स रहते. फिर भी पढ़ना, पहले बार इट लुक्स लाइक ए अनवांटेड डिकॉशन, second time it will start tasting little sweeter, and by the time it is January, you must love to live with those facts and figures until you get seat. The moment result comes next day, go and take a bath in Ganges in Varanasi and say goodbye to all topics and then start doing your post-graduation. But remember this list. Mycobacterium tuberculosis by macrophages, mainly it is the interferon gamma which is the one which mediates. Epithelioid cells in tuberculosis. Generally epithelioid means we will be thinking phagocytosis iske liye chahiye bolke. Nahin. They have got secretory function. They secrete the lysosome and variety of enzymes. That is the main function of epithelioid cell. Rosettes are a feature of pinnate medulloblastoma and retinoblastoma, not neurocysticercosis. Easy questions. Okay. Now doctor, retinoblastoma, what rosettes they are called? Flexor Wintersteiner rosettes. What is a lipogranulomatous condition? Calagion classically is a localized lipogranulomatous inflammatory condition involving sebaceous gland is what you have to basically remember. Once more, ocular lesion, extrahardiolum, interhardiolum, calagion, which is meibomian, which is sebaceous. वो सब चीजें फटाफट with full energy पढ़ लेना. 40-year-old obese, right upper quadrant pain. Ultrasonologist said fatty changes in liver, and isolated transaminase elevation is there. Alkaline phosphatase, everything is normal. Gamma glutamyl transaminase, everything is normal. She says that I never had a drink. I only was watching my husband drinking and I was preparing a good drink for him. Then why did I get this? Don't tell. Passive smoking can lead to lung cancer. Watching people drinking can bring cirrhosis of liver. वैसा कुछ भी नहीं है concept. मगर एक concept है, वो है NASH, non-alcoholic steatohepatitis, is what you need to basically remember. So, the most common cause of incidental elevation of serum transaminases, they present with fatigue, malaise, right upper quadrant dysfunction, etc., etc. I mean pain, etc., etc. Why it is not autoimmune hepatitis? Females, it is common, but you will have serological evidence. Typically, seropositivity will be there. Elevated serum IgG levels will be there if it is autoimmune hepatitis. Then what is the peliosis hepatosis? Why can't it be? There are cystic blood-filled spaces in the liver parenchyma. Typically those who are undergoing steroid therapy, anti-tumor chemotherapy, they will develop. HIV positive individuals who are immunocompromised also can develop peliosis. Which organism is implicated, doctor? Bartonella Hansley, leading to development of peliosis can very much happen. So one general knowledge question. This year I am expecting Nobel Prize for abolishing or bringing down the child labor. Can be a very, very strong MCQ. So when was HIV discovered, doctor? 1983. 83 is what need to be remembered. What is true about the staining? Methylamine silver stain will lead to fungi stain green is the only true statement out of all that. AIIMS के रिवाज है एक स्टेनिंग के ऊपर पूछना माइक्रोबायोलॉजी में. If you look at old questions also, Warthin's stain, etc., etc. That's the point. Then doctor, IgE, what is the wrong statement? IgE doesn't cross placenta. But what is the good news about this? Immunoglobulins is a high yield topic. Topic list में है, microbiology topic list में. It's an easy question. It fixes complements and it lead to immediate reaction. It can lead to anaphylaxis. Anything is true. Bacteria contain both DNA and RNA to make your life look easier. Hypothyroidism, what are the two anti-tubercular drugs which are implicated? One is ethionamide, other is para-aminosalicylate. Then the second line anti-TB drugs का side effects के ऊपर बहुत questions पूछा जाएगा. Thiaacetazone will give rise to Steven-Johnson, PAS, hypothyroidism. Ethionamide, optic neuritis, cycloserine can lead to psychosis and epilepsy. These are the important points to be remembered. Autonomic nervous system pharmacology. Every Friday when we discuss the previous year's papers, you will be finding ontogeny repeating phylogeny of Huckel. Same topic, same questions, same issues. We have to sort it out. That's how we get the top rank, top 100. So doctor, the list is important. You have phenylephrine like alpha-1 agonist. Alpha-1 agonist will lead to vasoconstriction. Alpha-2 agonist like clonidine will cause presynaptic receptor blockade, stimulation, leading to sympathetic outflow block. Hence they are also used as antihypertensives, clonidine, because they are alpha-2 agonists. Alpha-1 agonist करे तो hypertension बढ़ेगा. Alpha-2 agonist दिए तो centrally acting antihypertensives है, opposite function. Okay. Then beta-2 are terbutaline, and you have isoproterenol, metaproterenol, which are called non-selective beta agonists. Then you have mixed acting sympathomimetics like amphetamine, dextroamphetamine, ephedrine, epinephrine, etc. Then you have alpha receptor antagonists which are used in phagocytoma like phenoxybenzamine, phentolamine, prazosin, terazosin, etc., etc. Then beta receptor antagonists, all of you know very well, and labetalol like drug which is both alpha and also beta blocker. Which drug does not produce any active metabolite? There is no active metabolite for valproate. Recently we have come across, which entrance I don't remember, I think one among the Trinity or maybe West Bengal or Bihar or some lot of entrances, 2014 papers we are discussing, post-antibiotic effect. So doctor, this is a interesting question. Straight same question will come in the ABPG, TGPG, TNPG. What is that question? Post-antibiotic effect means there will be a persistent suppression of the bacterial growth in spite of only brief exposure by the antibiotic. Exposure time कम है मगर impact अच्छा है, ज़्यादा है, right? So as a physician tomorrow what effect you should have? Like post-antibiotic effect. 10 minutes you counsel your hypertension patient first time diagnosed means वो जिंदगी तमाम आपको याद करना है. डॉक्टर साहब उस दिन मुझे बोला, खाली 10 मिनट बोला, मगर मैं रोज सुबह उठते ही डॉक्टर साहब को याद करके ये बीपी टैबलेट ले रहा हूं. That's what your patient should tell. That must be your impact. Just writing metoprolol, atenolol, calcium channel blocker, get out, that is not correct approach. Right, doctor? If you don't impress your patient, diabetes and hypertensive patients to be compliant to the therapy, why they need to be, they will ultimately end up with stroke and end organ damage. So who is responsible? We are responsible. So we should not. So that is the story. Okay. What are all the drugs which have post-antibiotic effect? Aminoglycoside, fluoroquinolone, tetracycline, clindamycin, rifampicin, rifabutin. So इसमें कौन आ रहे हैं? क्लिंडामाइसिन आ रहे हैं, फ्लोरोक्विनोलोन भी आ रहे हैं. ये दोनों ऑप्शंस दिया गया पोस्ट एंटीबायोटिक इफेक्ट के लिए. But out of these two, which is time dependent killing, which is concentration dependent killing is the important issue. So basically time dependent killing is shown by penicillins, cephalosporins, carbapenems, monobactams, clindamycin, macrolides and linezolid. They all basically show time dependent killing. That means how much amount of time minimum inhibitory concentration के ऊपर है. That is very important. Then concentration dependent killing is shown by aminoglycosides and quinolones mostly. So these are the three important pharmacokinetic issues which you need to remember. Which Parkinson's drug lead to vasospasm? Migraine drugs, Parkinsonism drugs, doctor. Mark it in your diary. Definitely will be asked. Classically, bromocriptine because it is an ergot derivative. Marijuana, substance abuse drugs is another very high yield topic. So basically, AIIMS is opium. Cannabis ka what are the various forms? Ganja, flowering tops. Bhang means large green leaves and flowering shoots. Hashish is resin. Charas is resin from unfertilized flowers and mazoon is sweet. Is what you have to basically remember. Similarly, the other names, favorite names in the American streets. Ecstasy means MDMA. Knockout drop means chloral hydrate. Mickey Finn is alcohol plus chloral hydrate. Brown sugar is heroin. Angel dust is phencyclidine. Forensic में ये बहुत लाजवाब फेवरेट टॉपिक है एग्जामिनर के लिए. Methacholine acts on which receptors? Muscarinic receptors are in turn dependent to M1, M2, M3. On the respiratory tract, what you see are basically M3. We use methacholine in the bronchoprovocative test, no? Because it is selectively acting on the M3 receptors is what you need to remember. What is the function, what are the effects of alpha 2 agonist? मैं अभी बताया ना alpha 2 agonist किसके लिए इस्तेमाल करते? Antihypertensive. Alpha 2 are presynaptic. Any stimulation of them blocks the sympathetic outflow and hence they are used as antihypertensives. Since they are centrally acting, they lead to sedation, but they also help in anxiolysis and analgesia. So clonidine is the prototype of a alpha-1 agonistic drug, is what you need to remember. Pemetrexed. So what is this drug? It interferes, just like methotrexate, it interferes with DNA production, purine pyrimidine metabolism. So we give folate and B12, directly folic acid, not folinic acid. We give folinic acid to rescue if it is methotrexate, because methotrexate is inhibitor of dihydrofolate reductase. Dihydrofolate from becoming tetrahydrofolate, methotrexate will interfere. इसलिए directly you will give tetrahydrofolate, which is called folinic acid. That is used for rescue of what? Methotrexate toxicity prevent करने के लिए. But pemetrexed के लिए you will be using folic acid and vitamin B12. And where do you use pemetrexed, doctor? We use it for pleural mesothelioma and non-small cell lung cancer, is what you have to basically remember. What is the least emetogenic drug out of all this? Cisplatin, doxorubicin, daunorubicin, they are all notorious for causing boluses and boluses of vomitus. Clorambucil, that way, is more smoother. So anti-neoplastic drugs. Then if you take the various drugs and their action, what is a mismatch out of all this? Timolol does not increase the uveoscleral outflow. Any entrance you go, glaucoma drugs, their mechanism of action and their side effects. Very high yielding topic. Okay, doctor? So you must be quite sure, epinephrine is a glaucoma drug. It will decrease aqueous humor formation. But if you use it, stinging of the eyes is the problem, and since it leads to pupillary dilatation, you can't give it in a closed angle glaucoma. Closed angle glaucoma, generally surgery is the treatment, open angle glaucoma, medical management. Then brimonidine is alpha agonist. It also will decrease the aqueous humor production. Timolol, betaxolol, cartiolol, they are all beta blockers. They will also decrease the aqueous humor production, is their mechanism. But if you take what drugs will not affect pupil? Why it is important in glaucoma management? If it is a closed angle glaucoma, we don't want mydriasis because that will worsen the scleral outflow. So preferably we want a drug which is not affecting the pupil. Timolol, betaxolol, cartiolol are the classical examples of the drugs which will have no effect on the pupillary dilatation, is what you need to basically remember. So I leave the literature for you to review. Right. Which is not NNRTI out of all this. Raltegravir is not. What is raltegravir? Integrase inhibitor. If you did not read retroviral drugs classification, mechanism of action, today only invest your time, because that is definitely going to come. Raltegravir. Enfuvirtide is what is our fusion inhibitor, is our recent APPG question. So APPG, WBPG, JKPG, BHAR-PG, any PG is ultimately same story, FMGE. Furosemide, can you guess? AIIMS एग्जाम में ऐसे क्वेश्चंस पूछते हैं, असेंडिंग लिम्ब ऑफ लूप ऑफ हेनले के ऊपर फ्रूजेमाइड काम करेगा या डिस्टल कन्वल्जेड ट्यूपिल के ऊपर काम करेगा? If you did even this question also wrong, examiner will suspect your honesty. Ascending limb of loop of Henle के ऊपर सोडियम पोटेशियम 2 क्लोराइड सिम्पोर्टर को के ऊपर, that too thick ascending limb of loop of Henle is what you need to basically remember. Methadone. Methadone, what is the onset? Analgesia begins within 10 to 20 minutes and after parenteral and 30 to 60 minutes after oral medication. Just examiner changed the timings and expected you to answer. But you can answer this kind of questions by elimination. You know that it is used in chronic pain. You know it is mu receptor agonist. Of course, to know whether the onset is quicker or not by oral route is the challenge. So that's the point. The main advantage of methadone as an analgesic is it has an efficacy unlike the other congeners. By oral route only you can administer. That's the advantage. So chronic pain situations may treatment of heroin users. Usko withdrawal, suddenly you ask heroin to be stopped, withdrawal can occur. So methadone can be used for overcoming that. Chronic laxative can lead to development of hypokalemia, which is not uncommon in the geriatric clinical practice. Burnt robe smell, standard MCQ. Cannabis is what you need to remember. One IPC section will always be there. You can't escape it. Pray God that at least the section that you know will come in exam. In fact, in this exam there are 2 sections asked. So 193 IPC. Perjury means प्रॉमिस करके बाइबल गीता कुरान के ऊपर झूठ बोलना होता है, perjury in the court of law. Active component of the white oleander is basically nerine, is what you need to remember. In fact, all parts of the plant except the root are considered to be poisonous. This is such a standard MCQ. एक snake एक सांप तो एग्जाम में आएगा, पॉइजनस नॉन पॉइजनस सांप के बीच में क्या फर्क होता है, एवरीथिंग. So basically it is vasculotoxic and hemotoxic, viperine poison basically. Sea snake is myotoxic. Then you are having colubrine and elapidae, they basically are neurotoxic. So these 3 are the very fundamental questions on this snakeology. Then a person who is intoxicated is not considered responsible for his action. That does not mean that you drink well and kill somebody, right? So section 85 of IPC, any act done incapable of knowing the nature of the act because of the intoxication is not treated as a offense, is what need to be remembered. Then even if you are intoxicated, if it can be proven that you have an intention of doing that crime, then you are still punishable. That's called voluntary drunkenness, is not an escape or immunity in the law, is what need to be remembered. Then unsoundness of mind, section 84, as all of you know very well. So what is eonism? One sexual perversion is a part of the AIIMS MCQ every time, every season. So wearing dress of the opposite sex, right? Then what is fraudtourism? Contacting another person in order to obtain sexual gratification is basically called fraudtourism, which is punishable under section 290 IPC, 200 rupees fine. Underism is sexual pleasure of watching somebody of opposite sex urinating, is called as the underism. Then Gustafson's teeth assessment, favorite question, forensic, root transparency. All forensic questions are 5 out of 5 marks. You should correctly answer and come out of exam hall. Totally 8 to 900 single liners will be there, that you have to champion. Now doctor, so out of all, what is most? Root transparency. Which vaccine can lead to ITP, doctor? MMR is known to predispose. What is when the recrudescence of malaria? Suppose if your treatment is not fully effective, there can be reappearance of the asexual phase of parasitemia, which is then called recrudescence. So it is due to ineffective treatment, is what you need to remember. Then what is when the relapse? Hypnozoids in liver will be there, no? Unless you give a drug to kill them, they will persist and lead to development of relapse. What is the best way to assess the endemic hypothyroidism? Was AIIMS May 2014 question. The neonatal hypothyroidism, the taste of pudding is known by tasting it. color of it, anything cannot tell how it is. How effective is your control program is known only by finding newborn babies who are showing hypothyroidism. A boy got provoked, got an unprovoked bite from a neighbor's dog, and the police have caught it and it is found to be healthy. What is the next step? Basically start post-exposure prophylaxis and watch for about 10 days. So the entire post-exposure prophylaxis, categories of the rabies bites, category 1, 2, 3. For category 1 no treatment is needed, 2 immediate vaccination, and for category 3 means what? Typically whenever there is any contamination of mucous membrane with saliva from licks and exposure to bat bites etc. come under category 3. There you also need to give rabies immunoglobulin. Then once more, post-exposure schedule क्या होता है? Already if person is pre-exposure vaccinated, उनको क्या करना अगर dog bite हो गया तो? Dr. Amina is our wonderful community medicine teacher. So this Saturday and Sunday evening 4 to 8 she will be completing SPM. Next Saturday, Sunday onwards we will have Dr. Shilpa who will be teaching gynops every Saturday and Sunday 4 to 8 p.m. Please do come. Then what is wrong about isolation? So this is very important, doctor. Chicken pox, how long isolation? Until all lesions are crusted. Usually 6 days from onset of rash. Measles, typically from onset of catarrhal stage to the 3rd day of rash. German measles, rubella does not require any isolation. That is the favorite MCQ of the examiner. And influenza 3 days, hepatitis A 3 weeks, polio 2 weeks. Influenza 3 days from onset, but 3 days your reading room friend will be sneezing on your face. After that you will read this point. No use. Then I leave the literature for you. HPI, HDI, development index, poverty index, life and PQLI. One index के ऊपर question definitely examiner will ask. HPI में दो चीजें हैं human poverty index में. HPI 1 initially they started, and what are the important dimensions to know how poor is the human life in a given country? Human poverty index. First parameter in that is probability of at birth of not surviving beyond 40. What is the probability in a given country? That is one indicator. Adult literacy rate is another component in calculating the HPI 1. Then how is the standard of living? It is known by 2 parameters used in HPI 1. What are they? Percentage of the people not using the good water source and percentage of children who are underweight. They are the indicators of the decency of standard of living. Then HPI 2 has come. It said that all the things in HPI 1 are good. Additionally, we should also know whether there is any social exclusion. That also we should include. So earlier it was probability at birth until 40, no? In HPI 2 में वो क्या हो गया? Probability at birth of not surviving beyond 60 in HPI 2. Then percentage of the adults lacking the functional literacy skills. Right? Functional literacy skills. What is functional literacy skills? कहानी बोलना कितने जनों को नहीं आता, कहानी लिखना. So that is important. Additionally, what did they say? To know the standard of living के लिए HPI 2 में what parameter they have depended? How many people are below the poverty line? BPL group is an important indicator. Then they included one social exclusion as a parameter in HPI 2. What is that? The rate of long-term unemployment for 12 months or more. How many people are suffering? All doctors preparing for MD entrance will be suffering. 12 महीने बैठ के पढ़ना, 1 रुपए भी आएगा नहीं. Only thing is, unless girlfriend sponsors with her credit card a little coffee in the Starbucks, some fortune is there. Otherwise, 12 months, but you don't need to read 12 months, let me tell you. You are reading for 12 months for the entrance exam means you are not reading. Actually, most of the times in my long 1.5 decade observation, including my own preparation, was 4 to 5 months of a serious study. Out of that, a couple of months of real serious study. Real serious बोले तो इसको सीट क्यों नहीं आएगा, उसको सीट क्यों नहीं आएगा बोल के सोचते ना रीडिंग रूम में बैठ के, उसको छोड़ के हमको सीट क्यों नहीं आएगा अगर आप सोचना शुरू करें तो that is called serious preparation. That at least 2 months should go on. Now doctor, so examiner asked is 100 years living up to 100 years probability at birth of not surviving at age 100, is it included? No. It is age up to 60 according to HPI 2 is what you need to basically remember. Now doctor, hemoglobin status mean value was given 10.6, standard deviation was 2. Then what value 5% will be below what value of HB? Simple, you must know the rule of standard deviation. One standard deviation इधर उधर की तरफ कितने जने रहते? 68%. So one standard deviation is 2, no? Mean value 10.6. 10.6 minus 2, 10.6 plus 2. ये रेंज में कितने लोग रहते? 68% रहते. Then how much is left over? 32% is left over. I'll put the graph. Right doctor. So you are having a mean value. So you are having about 68% of people falling within one standard deviation. So how much is left on both sides? 100 minus 68, 32. That means each side how much is there? 16%. Right? So typically 16% of the patients, people will have a hemoglobin value either this end or that end, that is beyond 8.6 or beyond 12.5. Okay, then comes 95% will be within 2 standard deviations. 2 standard deviations कितना हो गया? 2 into 2, 4. So 4 plus 10.6 or 10.6 minus 4. 6.6 to 14.6 के बीच में, beyond you have 2.5% population. So if 16% have values less than 2.5% are having less than 6.6, ये दोनों के बीच में ही है ना 5. What examiner is asking. So then the lowest 5% of the population will have a value between the two. So the answer should be around 7.35. So that is what you need to deduce. Okay, doctor. So this is always standard deviation based questions are all logical oriented. Big calculations nahi rehta isme. This is such a repeatedly asked question, doctor. 4-5 AIIMS में same question was repeated. So waterborne diseases what are prevalent in disaster time? Vector-borne diseases what are prevalent? Zoonosis what are prevalent? I leave the literature for you. Now, ALMA art declaration typically has got 10 points inside it. Definition of health, equality, economic and social development as a prerequisite of attaining health for all, etc., etc. So the examiner asked which is not included out of all this. Provision of free medicines was not decided in the Alma Ata Declaration. So that's a point you need to remember. Now, doctor, kangaroo mother care, kangaroo PG preparation. What is the meaning of it? Very simple. Whenever it was actually taught by Dr. Edgar Ray, even this can be an MCQ in exam. Edgar is very famous man who started FBI in America. You must watch the movie based on Edgar. He has kept around 8 presidents of America in his hold, being an FBI chief. It's a very good movie. I am unable to recall what was the name of the movie, but it was about Edgar. Edgar is another man who is a FBI founder, right? So, kangaroo mother care. Typically, we give it in the people who are whenever to all stable LBW babies. Okay, then idea is skin to skin contact between mother and the child, or any caregiver and the child is the idea. So in that, what are the important, when do you do this? Whenever the gestational age is more than 37 weeks, kangaroo position means skin to skin contact, kangaroo nutrition means exclusive breastfeeding, kangaroo discharge means early home discharge from the hospital. Okay? So in exam, no kangaroo. Then when to stop kangaroo also is defined. Whenever the child achieves weight more than 2500 grams, or you finished 12 subjects out of 19 subjects, whichever is early. Kangaroo ko ruk sakte. So baby wriggles, you will say no more problem, I can live myself, baby will blink at you. Or if the baby cries, then under HBNC, आशा को क्या क्या करे तो पैसे दिया जाएगा. Basically, whenever she registers birth, whenever there is recording of the birth weight, or whenever she motivates the people to adhere to the health system, they are all the considerations for paying. Kitna pay kiya jate? 250 rupees is the payment done. For home delivery, how many ASHA visits will be there? This is going to be the favorite MCQ of the examiner. 7 visits. When are they? First day, third day, 7th day, 14, 21, 28 and 42. For hospital delivery, ASHA is supposed to go 6 visits, and it is mainly HBNC is what? For home based newborn care. It is not for institution. Right? Then 250 rupees are being paid after the delivery of the child for what? For registering the birth. And if the both mother and child, if they both are safe till 42nd day after delivery, if the immunization of the newborn is being done with BCG, first dose of OPV, DPT, then ASHA gets 250 rupees. Then weight is recorded and noted in the MCP card, then ASHA gets 250 rupees. So that is what is all about. Then which will not require chemoprophylaxis? Measles doesn't require. There are 2 formulas, doctor. पॉजिटिव प्रेडिक्टिव एक्यूरेसी, नेगेटिव प्रेडिक्टिव एक्यूरेसी. अगर आपको फॉर्मूलास नहीं मालूम है तो आप भी मग इट, टक इट, स्नीज इट. सो sensitivity into prevalence by sensitivity into prevalence plus 1 minus specificity into 1 minus prevalence will give you positive predictive value. How this formula derived? Not really required. Negative specificity into 1 minus prevalence by 1 minus sensitivity into prevalence plus specificity into 1 minus prevalence. This is important. General will give you sensitivity, he will give you prevalence, and he will ask you, also give you specificity and ask you to calculate negative predictive value. आपके पास ब्लूटूथ नहीं रहेगा, व्हाट्सएप नहीं रहेगा, दोस्त नहीं रहेगा, फिर भी आप ये याद रख के आंसर करना पड़ता. एंड डोंट थिंक एग्जामिनर इज सच ए simpleton who will give you true positives, all positives, and ask you to calculate positive predictive value. Utna मासूम नहीं है examiner. So be very sure he will give you this way and ask you to calculate. Okay, doctor? हाँ. Infant mortality calculate करने में stillbirths are not included because it is the number of deaths of children under 1 year per 1000 live births, and stillbirths are not included. About JSSK, Janani Sishu Suraksha Karyakram, right? So JSSK, ASHA, RCH, National Rural Health Mission, 7-8 चीजें हैं. You make a note of them and then review tonight only. Be strong with them. One question definitely will come in the exam. So under JSSK, a neonate up to 30 days will get a treatment free, not 1 year. That was given as one of the options. Whereas free delivery, free transport from home to hospital and back, free diet to mother during hospital stay, they are all included under Janani Sishu Suraksha Karyakram is what need to be basically remembered. What is all free? Be very sure. Free essential diagnostic, free drugs, free and zero expense, free diet, free provision of blood. My software programmer was telling, sir, ये पूरा notes आप website में डाले तो the students will be searching free coaching for PG medical entrance, and suddenly that will attract them to come to the website. So they will be mistaking that everything is free available here. Actually it is, we are discussing about JSSK free. So be very sure, because it is based on the keywords in the Google that population come to the website. Why are we keeping all these papers in the website is not out of charity, to basically attract more people to fall into our trap of taking coaching and taking mock tests with us. So free diagnostic, free provision of blood, all frees under JSSK. You be very sure about it, doctor. Sentinel surveillance in HIV is done for what purpose? To know the trend. आजकल HIV किस तरफ जा रहा है, उसका हवा, trend. High risk group कौन कौन है population में, कितने लोग हैं, how many are commercial sex workers, etc. To monitor the effectiveness of the control program, not for distribution of HIV drugs, we do the sentinel surveillance, is what need to be remembered. Then, which committee has said the rural medical practitioner with a 3-year alternative to MBBS doctor is recommended? Be very sure. Already after doing MD, there is a competition RMPs, right? There is another younger brothers of us are going to come out who are rural medical practitioners. Kali 3 years MBBS wale. We study unnecessarily 4.5 years, 1 year housemanship and forget what all that we read in anatomy, no? So it is the Health Survey and Development Committee which has proposed. Every year one new committee will keep coming. If neonatal death is 450, stillbirth is given, live birth is given, what is neonatal mortality rate? अगर आपको formula मालूम नहीं है तो you can't answer. Easy formula. 450 are all what? The neonates divided by live births. Stillbirths ka? No, it is only a seductive option. So it has no role in the answer. So in the National Program for Control of Blindness, schools में who is the one who will be doing the vision testing? राजू अपना दान दिखाओ के साथ राजू अपना आंख दिखाओ. Teacher will ask and the child is supposed to, the blindness is supposed to, refractive errors are supposed to be detected by the teacher. What is wrong about OPV? It does not lead to any circulatory antibody like IPV. It only leads to local immunity is what you need to remember. 28 weeks, You are suspecting retinopathy of prematurity. When will you do the screening of this? Is a very important question. Any baby born before 28 weeks should be screened either at 31 weeks of gestation or 4 weeks after the birth, whichever is earlier, is considered to be the protocol. Then once more, what is done by plus disease in retinopathy of prematurity? What is the treatment of retinopathy of prematurity? I leave the literature for you. There is one ATROP study which has given guidelines, treatment guidelines for management of the patients who are having retinopathy of prematurity. Soft exudates कौन सा layer of the retina में आपको दिखाई देगा? Actually, they are found in the nerve fiber layer. So, among the options was given ganglionic layer, which corresponds to that. Then another question that will come is hard exudates. Where will you basically find? It is the outer plexiform layer where hard exudates are found. One more question in the future entrance is microaneurysms, where are they found? Inner nuclear layer is the place where microaneurysms are found, is what you need to remember. There is a central scutoma and his right vision showed 6/6 vision, and the left eye there was a focal foveal detachment in fundoscopy in a young individual. What is your next step you want to do? Classical question. Basically, there is a decreased vision, metamorphosia, focal foveal detachment of the retina on fundoscopy. They all combined. What is your diagnosis? It's called central serous choroidal retinopathy. CSR is what you need to basically remember. And if you happen to, what are the risk factors for developing central serous retinopathy? Type A personalities, psychological stress, those who are on steroids, Cushing, pregnancy, anything can be the predisposing factor. What is a classical fluorescence angiography picture? When you put the fluorescent contrast and not in the eye, you will give peripherally and watch in the eye. So when you watch in the eye, it looks as a smoke is rising. That's called smokestack appearance. It's the characteristic feature of the central serous retinopathy. Matlab retina around the foveal area become detached from the underlying layer. So your contrast will rise like a smoke because the detachment is what you need to remember. Then doctor, microaneurysms are typically found in which layer? So examiner layer to layer is checking your retina, whether you are eligible for coming into Ansari Nagar or not in Delhi. So in their nuclear layer. Express glaucoma implant will maintain scleral outflow, uveal scleral outflow, that implant lagai to. How is it made? It is a non-valved MRI compliant stainless steel device which is of a 50 micron lumen, is what you have to basically remember. Are we going slow? Are you feeling drowsy? No? Or are you worrying that oh, itna cheeze hai kya padhne ke liye? Is a feeling are you getting? No problem. The point is, this re-emphasizes to you the fact how important to limit your preparation to selective list of topics. We will discuss JIPMER paper, etc., etc. When you see all those same issues, more or less will be rotating. Retinopathy of prematurity ke upar some other question will come. Central serous retinopathy recently we have seen in one of our mock tests. Favorite topic. Like that, it will more or less the issues will remain the same. Then what we need to do? We need to become confident and bring those topics into our control. That's the idea. 45-year-old with diabetes, type 2 diabetes may, today only you must look for the retina because we don't know when it started. 7-year-old left exotropia, right eye 6/6, left eye has only close hand movements and retinal detachment and telangiectatic cells. Such a classical clinical features conglomerate that listening to this clinical vignette on phone only, you must diagnose as an ophthalmologist. Coats disease classically, one of the high yield topics, a very high yield topic. It will have onset in early childhood. What is Coats? Coats is idiopathic retinal telangiectasia. Pathophysiology is idiopathic retinal telangiectasia. There is an intraretinal, subretinal exudation because of that. Telangiectasias are there, they will be secreting plasma out, that will be oozing out. Because of that, what happens ultimately? Retinal detachment occur. Which type of retinal detachment? It will lead to exudative retinal detachment. It is unilateral, that is another classical feature of it. And it is in the first decade of life, patients present with, as in this given classical clinical case in AIIMS May 2014, unilateral visual loss, strabismus or leukocoria like retinoblastoma. May aapko white reflex aata na, leukocoria. That will be the presentation because of Coats disease. And if you examine, you will discover those telangiectasia, exudative retinal detachment, etc. And what complications can occur because of Coats disease and telangiectasias? Those telangiectasias lead to hypoxia, hypoxia lead to neovascularization, neovascularization lead to rubeosis iridis, and neovascular glaucoma, uveitis, cataract, phthisis bulbi, anything can happen. So how do you treat? Classical question in the entrance exam. Anti-vascular endothelial growth factor antibodies, monoclonal antibodies. Anti-VEGF therapy is given for Coats disease because these telangiectasias which are there, we want to kill them. So we give anti-VEGF, laser photocoagulation, all that neovascularization, cryotherapy. Excuse me. Vitreoretinal surgery, and don't forget, enucleation also, one of the indications is Coats disease because it can lead to such a painful blind eye with severe neovascular glaucoma. When the patient comes, that becomes an indication for enucleation. Now doctor, normal corneal endothelium also, there are only two organisms which are capable of invading: Cornybacterium diphtheriae, Listeria, Neisseria gonorrhea. They are capable of invading normal corneal endothelium also. 54-year-old is having problem in the near vision. His vision is 6/8 for both eyes, which improved to 6/9 by adding one dioptric lens. What is the next immediate management you want to do for him? The idea behind this is, since his vision is 6/9, cataract surgery is not advisable. So that's the reason what you need to do. You need to do refraction correction. That's the only thing in this given situation. What is critical angle of the air corneal surface? Typically it is about 46 actually. Answer is B, not A. 46 degrees. Why is this important? What is the main difference between slit lamp versus gonioscopy? Typically whenever you are using slit lamp, you can't be able to look at the angle of the anterior chamber. Why? Because of this corneal air interface is 46 degrees. While doing direct slit lamp examination, there is an internal reflection of the light, so you can't see the angle. Whereas gonioscopy may this problem get eliminated. So why you can't visualize the angle of the anterior chamber on slit lamp means because of the cornea air interface, corneal angle being 46 degrees is what you need to remember. What will you use in pneumatic retinopexy? Will you drive air or gas? We drive gas, that is sulfur hexachloride. During gonioscopy, there is no need of dilatation of pupil. To do gonioscopy, you are looking at angle. Why do you need to dilate? Whereas fundus के लिए, laser interferometry के लिए, retinoscopy के लिए, सब के लिए pupillary dilatation is required. Now it is a glutathione which will basically prevent the free radical injury and help in scavenging those free radicals. Chuna powder is what? Chuna powder is a alkali which lead to burn. So to treat it, what will you do? You will wash with saline, you will do slit lamp examination, you will remove the double everting upper lid, you will remove the chuna particles, वो सब ठीक है. But installation of sodium citrate is not an immediate measure. Whenever alkali burn is there, immediately what you need to do, after some time what you need to do, there are all protocol of managing the alkali burns of the eyelid. So that's what you need to remember. A young 16-year-old has anemia. Frequent nasal bleeding is there. What is the most possible diagnosis? Male, young, pubertal, boy, juvenile angiofibroma. Bull's neck, Corynebacterium diphtheriae. Rhenitis was negative in right ear. What is the meaning of it? Rhenitis is negative. तीन चीजें होते हैं डॉक्टर Rhenitis में. Positive Rheni means what? Normal hearing में positive Rheni will be there. What is that? Air conduction will be better than that of the bone conduction. Air is better than bone. Is normal. That can even occur in sensorineural hearing loss. Negative Rheni means conductive hearing loss, where bone is much better than air. False negative means whenever unilateral sensorineural hearing loss is there, then patient feels as if the bone conduction is more than the air conduction. If there is a unilateral sensorineural hearing loss, bone conduction is better than air conduction, we thought it is a Rheni negative, but Rheni negative, it is not really a Rheni negative which is due to conductive deafness, it is due to sensorineural hearing loss. But how will you identify that? If you do the Weber, lateralization of the Weber will help you. Typically, the lateralization of the Weber will occur to the opposite side. In case of false negative Rheni is what you need to basically remember. I mean, false negative Rheni is wrong word. False Rheni negative. That's the point. In stepidotomy, what is removed? We remove stapedius, postcrura, anticrura of stapes, not the lenticular process of the incus. One question on CA larynx treatment will be there, doctor. Friends, you go. What book is very famous? Dingra, na? Ha. So you do Dingra, you do Kurana, you do whatever, Sholay, Ashiki, anything you do. But master the topic of laryngeal carcinoma today only, favorite topic. So doctor, T3N0, T3 का मतलब क्या होता है? There is a fixity of the card or hemilarynx, invasion of the pre-epiglottic, para-epiglottic spaces or post-cricoid area, that is T3. What are the various options which are available in the laryngeal carcinoma? You can do concurrent chemoradiation. Then you also have an option of induction chemotherapy followed by chemoradiation or radiotherapy alone, or a supracricoid partial laryngectomy, or near total or total laryngectomy, or a conventional open partial laryngectomy. Each of this, when will you do? According to the staging, you need to review it, doctor. What is wave 5 in Bera? Whole world gives one classification, Dingra gives another classification of waves. But what is the famous mnemonic? E. coli. E is 8th nerve, C is cochlear, O is superior complex, L is lateral lemniscus, I is inferior colliculus. So, regular, most of the other books they say start with 8th nerve as 1. So that lateral lemniscus become 4 actually. But Dingra's classification is lateral lemniscus is being treated as wave 5. So it depends on whom you want to depend and examiner what he want to depend. Okay. So that's the point. Shall we take a short break?